everybody. I am Dr. Arvind Ganpule. I am the Vice Chairman of the Department of Urology at Patel Urological Hospital. Today I am going to discuss on a topic which quotes a question: does risk of COVID-19 increase in patients suffering from urological diseases? I would start by saying that nephrourology is a medical subspecialty which involves the treatment of kidney diseases. So the subspecialty of nephrology deals with management of kidney diseases with medical management, while we, the urologists, are involved in surgical management of these ailments with any sort of surgical therapy. Since the outbreak of the COVID-19 pandemic a few months ago, it has been observed that there has been a higher incidence of acute and acute on chronic kidney disease patients which are afflicted with this condition of COVID-19. It has also been seen that acute kidney injury is noted in 3 to 9% of patients affected with COVID-19. If you go into the aspect of chronic kidney disease, as far as chronic kidney disease is concerned, it has been seen that there is an increase, or we can say that there is a higher risk of poor clinical outcomes in patients with COVID-19. More important are those subgroup of patients, say old people or our old brethren, who have got comorbidities and also have got CKD. The prognosis in these patients when they are affected with COVID-19 is a bit poor. It is in this group of patients, I feel that we should give our more attention and take care of them. Another typical anomaly that has been seen in patients afflicted with COVID-19 is proteinuria, which probably might be an harbinger of any future course of the disease. So this re-emphasizes the fact that COVID-19 also afflicts the kidney and not just the lungs. As far as the urological elements are concerned, we urologists have got a different impact. We have to see the whole issue from a completely different perspective. First, I would like to say that in addition to the effects on operating and the availability of staff to manage urological patients, the COVID-19 outbreak has also affected the outpatient and inpatient urological services. So we are faced with the decision regarding which oncological patients must be seen in the offices, which therapies must be continued, or how long these treatments can be deferred, if at all we decide to defer them. A second important aspect is that the treatment decision making. Treatment decision making for urological inpatients has also been affected. In a normal situation, say we were in 2019, the guidelines required that any patient requiring oncologic urologic surgery must be treated as soon as possible after diagnosis. However, owing to the COVID-19 emergency, surgery as fast as possible is recommended only for exigent uro-oncological emergencies. Now we have started to redefine and define, select and prioritize our oncological as well as non-oncological urological cases. For instance, the question that we pose to ourselves is a patient with Gleason grade 8 prostate cancer a higher priority than a patient with newly diagnosed high volume bladder cancer? Is a third stage kidney mass in an elderly person worse than a pheochromocytoma in a young patient while we decide to triage the patient or prioritize the patient? These are the new set of problems or questions that are coming in front of the urologist while treating these patients. There is no doubt that this confusion does not exist for other urological emergencies such as renal colic or retention of urine. These are the patients who have to be treated. There is one more aspect that we have to consider whenever we are considering urological manifestations of COVID-19, that is the blood testis barrier. It has been seen that the blood testis barrier is affected by the COVID-19 infection. So there are a few papers which have come out in the literature which say that particularly young patients who have been afflicted with COVID-19, after they recover, they should have a consultation as regards to their infertility status. So to conclude, I would like to bring forth the following points: that yes, COVID-19 in a way also affects urological community. However, particularly it affects those patients who have got chronic kidney diseases, and particularly those old patients who have got these comorbidities. Those are the set of patients whom we should take special care of. And finally, as I just discussed, the blood testis barrier. So the infertility aspect is also there, that what we need to consider and take into account. My last word would be is that the COVID-19 has definitely changed the way we look at a clinical scenario and risk assessment as far as urology is concerned. Thank you so much for your attention.